Typically, a bite is from an animal and a sting from an insect. However, there are some exceptions. When dealing with bites, there can be all sorts of different injuries. The main issue will be bleeding, but there also might be incisions to the skin or tears to the skin. Major blood vessels could be damaged, skin torn back, internal organs are damaged, and the patient will be very distressed, especially if it was caused by their pet. Other injuries could be bruising, soft tissue damage, and in some cases, even broken bones. The first thing we need to do is make sure the scene is safe. If, for example, a dog has attacked the patient, you need to make sure that the dog cannot attack you. Treat any wounds by cleaning using a saline solution or clean water. Control bleeding by applying a pressure bandage, and ensure that the patient has additional medical help they need. The patient will need to go to hospital, but may also need medications for infections caused by the bacteria in the animal's mouth. Stings are slightly different because the insect has actually injected the toxin of some description into the skin, which is causing a reaction. With bee stings, where the sting is usually left in the skin, this sting can easily be removed using a credit card, which is used to scrape along the base of the sting to remove the sting from the bottom. If you squeeze the top of the sting, it will inject more poison in. Generally, wasps, mosquitoes and other insect bites will be treated with creams or ointments and will usually get better very quickly without further medical treatment. The main consideration when dealing with stings is, could there be an allergic reaction causing other problems like life-threatening anaphylactic reactions, which we'll cover in other videos. It may be the person knows they have anaphylaxis, or maybe this could be the first time. If you notice that the patient is having any difficulty breathing, they feel unwell, then this may indicate that you have to contact emergency medical services. Talk to the patient and see if they have a history of allergies or problems, and make the judgment yourself. Typically speaking, if a person is stung on the hand, their throat shouldn't swell up, so if it does, this indicates an anaphylactic reaction.